A question that came in is about cortisone injections, yay or nay. And with regard in particularly to Hallux Rigidus, Hallux Limitus, and this is something that's oftentimes done. Cortisone is a very strong anti-inflammatory, and when injected, it is very specific to that region that it's being injected into. Therefore, it can be perceived to be very, very positive in reducing the inflammation. But that's not going to cure your problem, okay, at all. But it will help to set up the environment for you to cure your problem. Now, it doesn't necessarily have to be cortisone, but there should be an anti-inflammatory intervention for anyone who has Hallux Rigidus, Hallux Limitus. However, it should not be a long-term anti-inflammatory use. It should be temporary and then done concurrently with other things to help undo the mechanisms that are causing the Hallux Rigidus, Hallux Limitus, or whatever other problem that you seem to be experiencing. In fact, the research I'm reading is showing that cortisone or injections to a joint alone oftentimes do nothing. However, when they're incorporated with a physical therapy intervention, and I would say an appropriate physical therapy intervention, that they can be highly effective. So when I was practicing and working with rotator cuff injuries, for example, or they would oftentimes present with a lot of inflammation in that particular joint. I found it highly beneficial. If my patients weren't doing that, I sent them to the doctor to get a steroid injection like cortisone into the joint. And then it would help me address that inflammation. That inflammation was taken care of so that I could then address the protective stabilizing muscles around that joint in the shoulder. And there are those stabilizing joints in the big toe as well. The key thing is that for every cubic centimeter of inflammation, a muscle shuts down by 1%. So if you do not address the inflammation, you're really working uphill. You have an uphill battle with regard to getting those protective stabilizing muscles activated again. Therefore, doing the anti-inflammatory intervention concurrently with a couple of other interventions is highly beneficial in moving you in the right direction toward relief, recovery, and ultimately resilience. So I've included a PDF to below this video for you to go ahead and download to take a look at the 8 things that should be done at the same time to really get out of pain ASAP and start moving into relief, then recovery, and then ultimately resilience from future wear and tear. Because just pain relief, which may happen with a cortisone injection, will be temporary and will not be, if it's not, if that opportunity is not taken, is really not going to do anything for you in the long run to result in a decrease or a recovery from the Hallux Limitus, Hallux Rigidus. It's just making you more comfortable. And truthfully, when we feel more comfortable, we want to go out and do more. When you are moving on a toe that has Hallux Limitus, Hallux Rigidus, every step that you take, every move that you make is causing damage. It's like driving a car with a flat tire. You get a flat tire, you pull over immediately. Why? Because if you don't, you're going to literally break the car. In the human body, it doesn't quite work that way. The body will go ahead and take it and take it and take it. And especially if there is no pain or the pain is being masked by some sort of anti-inflammatory or analgesic or some other pain reliever, you are still doing damage. So ultimately, set aside the time, put a program together, look at my program for it, and really go ahead and commit yourself to a couple of weeks out of your life to get this thing resolved, and then ultimately have the body that will no longer require all of this special treatment that's actually working properly, not only change the tire, but fix the whole system, fix the whole axle so that the car is running properly and the tires are moving correctly so that you are no longer doing damage. You're recovering from this particular issue, and the entire body, foot, and system becomes resilient to future problems, not only physically, but then mentally you will have the knowledge of what to do should you encounter some pain or issues in the future. You'll have the methods to go ahead and address it so that they do not get worse and that the problem does not become complicated, a chronic problem, and a very, very debilitating problem ultimately, because a fusion is debilitating to the entire body, not just the toe. So I hope that answered your question. And if not cortisone, some anti-inflammatory, but don't bother with it unless you're ready to take action in the other ways as well. Bye for now.